My name is Fistula. I'm from South Africa. I was diagnosed with fistula about a year ago, and I've had two previous major surgeries for perianal abscess, which was very difficult for me. And finally, we got introduced to Dr. Garg via a patient whom we known from our country. We were very skeptical when we first, heard about Dr. Garg, because we were coming to a foreign place. But we were very surprised when we got here. The place was very comfortable, and the journey was very comfortable for us, more than we expected. I came here in excruciating pain, basically surviving on painkillers until the last moment, and I received very prompt treatment from Dr. Garg and team, and they were ready to take me in and start treatment immediately. But we were also surprised that Dr. Garg was very thorough in his background work before jumping into treatment, and we could genuinely feel that he wanted to help me solve the problem. Which was very different from other cases where surgeons were just ready to operate without even thinking. So we did an MRI, which for the first time I felt was read accurately, because we've experienced a lot of confusion with MRIs, and we were explained thoroughly about how and exactly what the condition was and where it was, which I didn't know before coming here. And obviously, until surgery, it was a bit of a scare, but after surgery, we were pleasantly surprised at how minimal invasive it was and how smoothly things went. And the treatment we received post-op was something we've never experienced in other hospitals. We were given daily dressings, daily consults with doctor, which we don't get anywhere else, and close consultations with doctor to see that, which showed that he really genuinely cares about his patients and wants them to progress and finally be cured of this illness. So it was a very special time here in Chandigarh. My mom can even say the same, because she's been through it with me, and very emotional because I've had this problem for so long, and finally we found a solution and a doctor that's just as close to God, because he did everything.
Hello, I'm Kasai's mom, and as she mentioned, that it's a journey that I have to go through with her, and really we feel blessed that today we can even do this video with you and feel so confident. And again, just to talk about her history, we took it for granted, and when we arrived here on the 12th of October, all we wanted, like any other surgeon, is for Dr. Garg to just go ahead and do the surgery. And he spent so much of quality time, and I think really that's something that's very heartening, because I do come from a medical background in South Africa, and having the experience there, I can tell you that this is just amazing. And when he first saw us, the fistula was so complex. He said to us, he's done 3 similar cases, but not a case like this, and this was really complicated. And he's not sure whether he's going to do this, but let me think about this overnight and I'll let you know tomorrow. So you can imagine how thorough he was. He could have taken us to surgery straight away, investigated there, and then said, I can't do something. So the next morning, we were booked to the hospital. Again, so well structured, so programmed. And I must also say it was amazing to have Dr. Garg here on a Saturday afternoon at 3 o'clock, 4 o'clock, to see us and welcome us. So I think those things we'll never ever forget. And when he was entering the surgery, he said to my husband and I, we were sitting outside, don't worry, it'll be fine. And nobody even understands those words. I think, just to hear him say, don't worry, that comfort. And you can see the passion and, the divine in the doctor, I think adds to his profession, really indeed. When he came out of surgery, he also said to us, don't worry. He himself couldn't believe how well the surgery went. And he found every track, which I can tell you no other doctor. I'm sitting here in confidence and telling you that it was such a complicated situation. She had 4 very difficult tracks, and her sphincter muscle was not even tampered with. He just again reassured us. He was smiling and saying to us, everything went so perfectly. And again, I believe that because Dr. Garg has so much of spiritual feelings in him, as well as his academic, his profession, it's just amazing. So again, to reinforce, the post-surgery is usually very traumatic, and I think that is why we delayed the surgery for such a long time, almost a year. And the care that we got from this institution, really, I'm just trying to think how Dr. Garg has planned this whole process of patients being operated, and then he follows up. And to be very, very frank, she's been through 2 other such processes. A surgeon does not follow up a patient post-operative. It's usually said, now you go back to your GP or your physician and he will check on you. This surgeon was seeing us practically every single day, including a Saturday, including a Sunday. And I think for that kind of patient care, you will never get it anywhere in the world. And I really want to be very, very strong and say this. And the cost towards this is also minimal. If you look at the entire process, we've been here for 4 weeks compared to what you would pay in other places. So you're getting a package that is cost effective. There's so much of love, there's so much of care. So really, I can't even reinforce anymore. And all I want to do personally, I think on behalf of the side, is encourage other people, because I know now how many people are going through this. And we were surprised sitting here, it became like a support group. And because my profession is more with infectious diseases, I only know about people having support groups. But this became like a support group where patients see each other, they share their experiences. We become like a family, and we must thank Dr. Garg for this wonderful opportunity, for caring for these patients. And I also must not forget, there's 2 of his support staff. We call him Uncle and Vikas. They are absolutely spectacular. You can WhatsApp them at 1 in the morning and they will give you an answer. So we just want to say thank you from the deepest part of our heart, and I know that this work will carry on with God's blessings, and we certainly will come back for follow-ups here. We certainly will refer patients who really need this help. So we thank you so much, Dr. Garg, for this wonderful, really, journey that we had with you. Thank you so much.